to taxpayers and higher income households.
Well, we can have a whole debate about taxes and the logistics of taxes, but let's talk about what's good in the bill. For now, like, what are the positive aspects of this bill? I know myself as a progressive, I have certain doubts about how far this bill goes. I mean, specifically the lack of a public option. But what do the rest of you think about the bill, Paco? Yeah.
I mean, well, I guess putting aside the specifics of the bill, just generally speaking, this is a major piece of social legislation. And there was an article in the New York Times recently that I think hit the nail on the head when it said, it basically stated that Obama's tackling inequality, which has gotten really out of control the past half century or so. I mean, it's really insane when you look at the numbers. I studied abroad in Ghana last semester, and there are people in this country who, as individuals, have more money than the entire GDP of Ghana. It's a level of inequality that gets to the point of being obscene. And so the fact that this legislation, flawed as it may be, is addressing that and trying to reduce that, I think is a major, major, major step in the right direction.
Especially considering the polarization of our politics, the fact that Obama was able to get this through Congress at all, I think is pretty impressive.
The bill also sets up comparative effectiveness research, which, from a financial standpoint, the CBO has not taken into account at all in terms of potential savings. So,
can you explain what those are?
Yeah, basically that the government is going to try to sort of streamline and determine which approaches to specific illnesses and diseases are the most effective, and pretty much like where you get the most bang for your buck in terms of treatments for cancer and diabetes and which drugs are most effective. And then by sort of making that the standard for care, saving a lot of money over trying a bunch of different approaches and really just sort of engaging in this hit or miss treatment. And like I said before, the CBO hasn't taken that into account in terms of potential savings, so that could be a huge boon to this idea that it will reduce the deficit.
Okay. And what about the specific insurance reforms? And I know a lot of people will be happy about, us specifically would be happy about staying on our parents' health care until we're 26. But I mean, what other benefits are there to people who already have health care and those who will get it in the future? Anybody?
Well, you can't be dropped from your coverage just because you get like a new illness or something like that.
Right.
And in addition to that, like one of the more immediate effects is that if you have a pre-existing condition as an adult, the government is going to have some sort of temporary insurance health plan until 2014 when the exchanges actually start to kick in. So that's one of the more immediate benefit.
In addition to, in addition to canceling lifetime caps on care, ending discrimination based on pre-existing conditions, and closing the donut hole for elderly citizens with regard to Medicare, so they'll be able to pay for more medication, or rather, the government will pay for more of their medication. So these are things that the country will be experiencing like within the near future, within 6 months, hopefully.
I think it also says that Medicare Advantage insurers will need to spend at least 85% of revenues on medical care, so more attention to that.
Right. And in addition to, I think, more people being added to Medicare and Medicaid, I think children and more elderly people. So there are very good immediate aspects to the bill.
But I think that is true. I mean, the bill has obviously very positive aspects, and they poll very, very well. But I think just detractors of the bill will say that it costs too much, like $940 billion. Is that the most cost-effective way of reforming the healthcare system that we have right now?
Well, is it?
Well, with that, we can move into the lack of inclusion. I think, as Tim would phrase it, the lack of inclusion of Republican ideas in the bill, and whether or not those ideas could have helped reduce costs even more? I mean, I know you're concerned with tort reform and selling insurance across state lines.
Well, yeah, I mean, in terms of lack of Republican ideas, yeah, like you were saying, there really isn't any inclusion of medical malpractice reform. The American Medical Association has said that including some of that might reduce costs up to $200 billion annually, and wasn't in the bill. In addition to that, there's nothing that allows insurance companies to market their insurance plans across state lines. And so, again, when you open up, when you allow free market principles to take place, then that's one way of reducing costs.
Bruce?
I think one of the aspects in which this bill is weakest is in cost control. Two of the proposals that I liked the most were cutting down state-to-state borders and also the public option. Both very different ideas. One was more popular with Democrats, the other more popular with Republicans, but both of them address this issue of encouraging competition between the companies, and I don't think the bill has done that very well.
And just to add, the public option was actually very popular with the American people. It pulled very well. Something like 55% of Americans supported the public option.
And I don't think the idea of cutting down state-to-state borders was explored enough by Democrats.
Right. But just in defense of the Democrats regarding selling insurance across state borders, just talking myself being from California, that California has very specific rules regarding what healthcare insurance should provide, what it can and cannot do. I would think there would be a big logistical headache in letting out-of-state insurance companies sell insurance in states that have very specific and stringent rules about what should be provided.
It would be a big logistical mess.
Right.
It would have to be something that would be looked at. But over the long run, I think it would be good. Over the course of 50 years, you would see big national insurance companies arise, and you wouldn't see a situation where right now we have states where one insurance company controls 70% market share.
Well,
I don't think it was necessarily a concern of a logistical mess. I think I read something in the New York Times where it said that if it was the fact that if you lived in a state that didn't have very many mandates, that the insurance plans, the cost of the insurance plans would be lower. Like, for instance, someone living in Kentucky would be paying less in insurance than someone living in New Jersey because New Jersey, as a state, has set up a lot of different mandates and forced all the insurance plans that are being offered in New Jersey to have, a lot more. There are a lot more regulations attached to the plans that are being offered there, and so people from New Jersey might want to buy insurance that is being offered in Kentucky, and that'll raise the prices of the people who live in Kentucky. It's not necessarily a logistical problem. It's just some people might argue that there's no net gain.
Okay. We mentioned the public option, and we're talking about private insurance companies and the public option. Many progressives argue that this bill doesn't really do anything to break the current, the hold of insurance companies on healthcare. What it really does is just deliver some 30 million more Americans into the hands of private insurance. Is this really a way to solve the problem at all? And how would their inclusion of a public option have helped solve the problem?
I don't think it's simply delivering 32 million uninsured people into the hands of insurance companies because you can look at it from the perspective of, okay, well, now we're mandating people to have insurance, and now, okay, well, the insurance company now has a lot more customers, but these customers, the insurance companies can't deny people based on pre-existing conditions. So let's say you have a terminal or a very, very bad some sort of illness. the insurance companies have to cover you, and that's going to bring that's going to reduce their own profits. So it's not simply just